Welcome, everybody. Today we're getting together with Rackspace, and we have the privilege of talking with Sandeep Mishra, who is the healthcare lead over at Rackspace. And we're going to learn a little bit about cloud migration. We're going to learn a little bit about their offering when it comes to Epic hosting, and some different things and flavors that they have that's very applicable to healthcare organizations nationwide. And so I'm going to let Sandeep introduce himself, tell us a little bit about Rackspace, and then we're going to dive right in, and we're going to learn about the successes and the things that we can very well equip organizations to be better for better outcomes. Better outcomes in healthcare is also very important. So Sandeep, please take it away and tell us a little bit about things.
Yeah. Hey, thanks, Wade. Thanks for having me. It's a pleasure to connect with you again. And as you know, from an introduction perspective, just real quick, I've been with Rackspace about 15 months or so, and I've been in healthcare about 15 years in different capacities, working from startups, launching new products, private equity-backed startups, to the likes of Amazon, which is where I was prior to joining Rackspace. I was in the strategic partner organization at Rackspace, working with the most, I guess, the strategic most important partners that AWS had within the healthcare space. Now, within Rackspace, my responsibilities lead global sales for healthcare, and provider side is the biggest focus area for us. And within the provider business, Epic migrations, Epic managed services, from a hosting and application managed services perspective, that is the biggest area of growth, the biggest focus area for us as well. And Rackspace as a company, just real quick, we've been around for over 20 years. We started off as a dream for our co-founders in San Antonio, Texas. They were all college roommates, and they said, "Hey, let's open up a company that racks and stacks, builds servers," and the old story about data centers, if you will. And then slowly we progressed into where we are right now. We've done tremendous things in several industries, including obviously healthcare being one of them, but financial services, media, tech and entertainment, gaming, so on and so forth. One of the most proud moments for Rackspace from a cloud perspective, and this will resonate as we discuss more about the hosting aspect of Epic in different formats, is Rackspace worked directly with NASA in building out the first public open source public cloud, which is OpenStack. So it's something that we take a lot of pride in. It speaks to our lineage of our understanding of the cloud, how it's evolved from over the last 20, 25 years. And our message to our customers across the board is, don't let cloud dictate what you can do. Figure out what you want to do and let us work with you to figure out what the cloud options look like. Is it entirely a private cloud option? Is it a combination of private and public cloud in some way, shape, or form? You should have the ability to access an infrastructure and management services across the board as they fit your need. So that's kind of what Rackspace philosophy is and mindset is as we approach healthcare, because obviously it's a unique beast as compared to other industries. So that's a little bit about Rackspace and myself. Happy to answer any specific questions that we can address for customers that are on this journey.
Well, yeah. Well, let's focus on a very popular, which is EMR. EMR. In the cloud, on premise. I personally dealt with the EMR migrations, but I've had them on premise, and I've had to go and migrate to the cloud. And a lot of people don't understand the difference, of course, and a lot of people don't understand. There is a cost savings there. There's a resource savings there. So tell me a little bit about your EMR workload. The potential of how that would go to Rackspace, and we're talking in this case Epic specific, because that's one of the largest ones that you guys are working with. And tell me a little bit about how that works, and how does that evaluation start, and what does Rackspace offer when it comes to that?
Perfect. Thank you on that. So yes, you are correct. Obviously, the most mission critical workload in organizations these days is the EHR, and Epic being one of the most important aspects of our industry, the biggest EHR. And has delivered a very quality product to the patients, to the physicians, to be able to provide quality care. But the back end, where a lot of quote unquote sausage making is done on how it's hosted, how it's managed, how it's run, that gets very complicated, and that's where the IT organizations try to balance out a lot between cost, efficiencies, talent, and other challenges that they have, cybersecurity, for example, things like that, right? So the IT organizations are severely challenged across the board to figure out the best home for that EHR and in the manner that it can run most smoothly at the most cost efficient manner and be able to scale as the need be for those organizations. So when you look at any EHR for the matter, in this case, let's talk about Epic as we were discussing. There's four ways you can possibly host any EHR. You can host it on premises if it's not a truly SaaS EHR. You can host it within the data centers provided by the EHR if that's the way it's being offered. You can host it in cloud. Now within cloud, there's two separate buckets. One is the private cloud bucket, which is where Rackspace fits in primarily. And then the other is the public cloud bucket with the hyperscalers, right? So there's pros and cons to your point on every single way of deploying an EHR, of running the EHR of that deployment method. You know, there's if you look at the on-prem side, for example, there's a massive capital investment to get the infrastructure up and running, and then be able to hire the people to be able to run that said infrastructure along with the expenses of running the application. And that puts a lot of burden on organizations because margins are low to begin with, and they're really constrained on budgets. And now all of a sudden you've got a big capital outlay and you're constantly stressed out about, hey, what if something fails? If there's downtime, am I going to be able to get the replacement parts in time, or be able to have the right people work on this? Do I have the right talent to be able to work on this? I think you and I were in one of the conversations with a CIO from a smaller or rural market, if you will, where they said, hey, I'm constantly competing because my people they learn, they get really good at what they do, and then they just get up and leave.
They move on. That's right.
Yep. And that is a big challenge for a lot of CIOs. Go ahead.
And so speaking of resources, so you have the certified resources.
Yes.
That take care of
that.
That's
what I was going to say. So if you look at Rackspace, for example, the way we work with our customers, or the way we support our customers is, hey, we're going to build the approved infrastructure for you in our own data centers. We've got over 35 data centers, either owned or leased, global footprint. And so we're going to build the infrastructure for you that suits your need. It's going to be all approved infrastructure from a hardware perspective. And then we have the Epic certified resources, the ODBAs, the ECSAs, and all those to be able to manage the application as the need be.
Very expensive resources.
Exactly. That's a very expensive pool, and very talented, intelligent individuals that we have brought on board to be able to support those applications. So again, our responsibility to manage the infrastructure, the application, the security. And that's obviously can't be said enough about being able to provide security as a managed service with the sheer number of attacks and threats that healthcare organizations are under constantly from bad actors.
Yeah, and it carries a service level agreement as well, which is very important.
That what we noticed in the industry a lot of times was, hey, we'll provide all of these, but from an SLA perspective, it's not either as high as what we are, especially. So Rackspace is 5 nines of availability for the infrastructure, and we have financial penalties associated with the SLAs. So what we're saying is, not only are we going to give you an approved infrastructure, we're going to give you the right people that have the skill set and certified resources. We're going to back up what we say with 5 nines availability.
Right.
And if we don't deliver, we're going to have financial penalties associated that it hits us as well on performance.
It makes perfect sense. And I think from my investigations and learning about this solution that you're offering, I can go back and relate to my days in healthcare where, one of the big concerns that I think you solve this problem is if with these providers of the actual solution itself, if it's an Epic or if it's any manufacturer, doesn't matter, or any solution provider, you're kind of in that cloud. If it is it's theirs, the integrations are a little bit unique and hard to get integrations done. But by being kind of in your data center, it's more of the integrations are very easy, and there's a lot of different integrations that could be done. And in my example would be in healthcare, I have multiple systems that need to be hosted either on-prem in my data center or in the cloud. Rackspace can not only take the EMR, but you're able to take all of that solution and provide a more seamless integration and bundle those resources. Is that not accurate?
That is absolutely the case, and that's one of the big reasons why we've been so successful in the market and getting some of the largest customers, health systems, to migrate their workloads to Rackspace, is because they realize that, okay, I can solve the EHR, for example, is, again, it's a mission critical workload. It is the most important application, tier 1 application, but there are a lot of these applications that still contribute to the overall cost, that still contribute to the overall threat landscape when it comes to security. Yeah. And I got to figure out something to do about that. So if I'm going to get out of my data center, I should have a strategy in place where I can completely exit out of it. I don't have to worry about, hey, I got to hire 4 people or 5 people or 10 people to be able to run that. Rackspace takes it all. So the bolt-on applications, if you will, or ancillary application, your packs, your limbs, all
there
those,
you go, storage, everything. Yes,
right. The one-off weird applications work with, for lack of a better term, be able to take those and be able to host them within Rackspace, along again with the SLAs and financial penalties associated with performance. It's a very big attractiveness for our customers that they come to Rackspace.
And you tack on security, you tack on disaster recovery, and then that makes it a complete package deal. And it's really not even an all my eggs are in one basket scenario, because you're diverse, and because the way you positioned this is not where it's a single point of failure. It's literally giving the resources and the ability to do something you can't do on-prem, or something you can't do with a single vendor. Even though you're a single vendor, you're bundling all of this together to give them a very good outcome.
Yeah, and if you think about it from from a disaster recovery perspective, or the single point of failure, as you mentioned, given the fact that we have over 35 data centers that are geographically split, we really work very closely with our customers to say, hey, where do you want the prod to be, the production environment to be? Right. And God forbid, if there is a natural disaster and you got to switch over to the DR, we need to make sure that it is geographically diverse enough. Yes. Right. And that, but it still has the smallest latency between those data centers to be able to, and your site to be able to bring that up as soon as possible. So that really helps the customers for the ease of mind that, hey, if something were to happen, I've got the backup, the disaster recovery. And on top of that, we've got connectivity to all the hyperscalers, right? So we have dark fiber connectivity and the backend built to Google, Azure, AWS. And if the need be, and if there's a preference, or if there's a desire of the customer to tap into hyperscaler capabilities, well, guess what? When you're with Rackspace, you do have the flexibility to say, hey, I want to tap into Azure for this, or AWS for this, or GCP for this. And we have the flexibility because we've got those connection points already built in to those hyperscalers' availability zones.
That makes a lot of sense. It makes a lot of sense. And you have the resources to do it. I mean, whatever they need. So, I'm assuming that this engagement would be, you get a client rep, and that's just your person that you deal with, and, they handle everything for you. So from the start to finish, and, they've got a good contact and a good project management suite, I guess, for lack of a better way to put it. So holding hands and really taking care of these organizations, because again, it is the most important asset of the healthcare facility, is their EMR and their ancillaries that drive patient results and patient safety at the end of the day.
You hit it on the head. My team, what the goal that my team works with, or the absolute focus, and that's across the board, is we might not be interacting directly with patients. We're never going to interact directly with the patient with the work we do. But the people that are making an impact into their lives, the physicians, if we don't do what's right by that customer, that physician is going to have one challenge or the other at some point in making sure that patient is taken care of. So we take a lot of pride in what we do, even though we're on the sales side and dealing with the IT organization. But we do understand at the center of the universe for us, what we do is patient outcomes. And it could be our own family members. It could be our friends, right? So it is very important to us, and that's the sense of urgency and connectedness that we work with all the customers.
Absolutely. The healthcare clients to Rackspace is not really clients; they're really partners. And that's really what it would look like, because the depths are just basically endless
Yeah.
as far as
And,
things that we
you
can
know,
do.
and that's the reason why. So we, I was just talking to one of the CIOs this morning. So, we have some of the most innovative and the best names in the industry as part of our portfolio, as part of our customer pool, if you will, fortunate for that, to have, the leading pediatric hospitals in the Northwest, in the Southeast, one of the largest health systems in the country to be part of Rackspace for their Epic workload to be hosted and managed by our people. And it puts a lot of pressure on us. But we love
Yes.
that. We do love
Yes.
that because we know we built it in a way that we can manage it and we can deliver the performance that they come to expect from us.
So the summary of that part is it's a valid story. It's already being proven, and we've already got organizations moving in that direction because it's proven, trusted, and it works.
Absolutely. And we're, any potential CIOs or any other CIOs that would love to have a conversation with us, or that we would love to have a conversation with, we're absolutely, as we move forward in those dialogues, we will have a chance, we'll present the opportunity for them to speak with the other CIOs that are trusting us with this mission critical workload and their extended team. So, we'll engage as the need be. And obviously you understand this space probably better than a lot of other people because you've lived this day in and day
Sure.
out in your past role. So I think it's a good mix of your advice, your direction, along with our expertise, and working with the actual organizations to say, hey, how can we come together and create this perfect plan to migrate a mission critical workload to Rackspace and manage it in the best manner at the lowest cost possible with the highest performance criteria.
Absolutely. It is worth a conversation at the very least.
Absolutely.
That's it's
Would
worth
love that.
these CIOs, CTOs having conversations with Rackspace on their EMR workload and how we get it to cloud migration. So
We would absolutely love the opportunity to get in front of them.
good deal. Well, listen, we're going to wrap it up. And Sandeep, thank you so much for your time. And any closing words you'd like to say as we wrap this thing up?
No, first of all, thank you so much for putting this together. It's fun, as you can see, I get excited about this. It's fun to talk to
Education.
someone
Love it.
who's lived this, and that we trust as one of our partners, and that our pool of customers. Again, we're so blessed to have some of the most innovative CIOs that we get to tap into their brains and get challenges from them and look at the next iteration of their overall workload. So be it from an AI perspective, machine learning, high performance computing, genomics research. I mean, they're challenging us with all this because they see we can do something very important in the right manner for their most mission critical workload. Then they say, hey, let me challenge you more. And it's a fun ride, man. We enjoy it tremendously. And any opportunities we can get to talk to the CIOs that you interact with, or the CTOs within those organizations, would love to do so.
Sounds good. Well, listen, we appreciate your time, and we will catch you on the next one.
Thank you so much, Wade.
Take care.